So now we're going to move into our new 500 Continental delivery system. This is, in this specific instance, our Continental delivery system. We also have our traditional delivery system that will have your traditional whip that the handpiece will stick and the tubing will hang down. But for this specific instance, we're going to utilize our Continental delivery system. So the first thing that I want to show you is the ease of use of this delivery system. There is a capacitive switch that my fingers are touching which allow this delivery system to be placed where I would like it. So as soon as I let go, it locks into place. That is a capacitive switch that uses what we call positive positioning to place that delivery system to where we would like it. So as we look at the back of the delivery system, there are a few changes to this Continental delivery system versus our older Continental delivery system. Number one, we have this new oil collector that is much easier to take in and out versus our older oil collector that basically snapped on. We have an O-ring here that we need to lubricate about once every 6 months. We still have our 2x2 gauze that we're going to want to replace once a month. We also have a cotton roll in here that's going to act as a muffler for our exhaust, so that if you do hear any extra loud noise from our exhaust, you're going to want to make sure that this cotton tip applicator that we have in here is right in this position where my finger is. We want to make sure that that's in there and that that stays in there. So to push this back in, we're just going to turn and lock that. We have our flush toggle right here that if we needed to shock the lines or we needed to flush the handpiece positions after an implant case or something like that, we can go ahead and flush our lines by just flipping this toggle up. Over here on the opposite side of the back of the delivery system, we have a powered USB hub. So if we wanted to add a peripheral like a camera, or we wanted to plug in a digital sensor that we were going to run the line through back to our camera, we could, back to our computer, we could actually do that. So that is the back of the delivery system. As we turn this delivery system around to the side, and I get this into the field of view of the camera, you'll see that we have a few knobs here and our power button. To turn on and off the delivery system, as we've shown already, we're just going to flip this down or up depending on whether we want the unit on or off as our master toggle. This first lower knob right here, this is actually our air coolant. What our air coolant actually does is it amortizes the spray of water and air to make a mist. So that's going to change the amount that the water mists when you're trying to cool the burr as well as cool the tooth surface that you're cutting. So we're going to be able to adjust that with just kind of turning the knob, if you will, for our air coolant. These four knobs right here, these are actually our water coolant knobs. To adjust the water flow out of our handpiece or scaler, we can actually adjust with these knobs right here. The one thing that's important to note though is that we don't want to completely turn the water off all the time with these knobs right here. We can use our foot control to turn the water off, or we can use our touchpad to turn the water off. One nice thing about having these knobs right where they're at is that when I bring this high-speed handpiece forward, what you'll notice is that that position then lights up with a blue LED ring. That's going to allow me to know that I can adjust my water from there. And then once I want to turn that water on and off, I can just turn it on and off once again from the touchpad. Right underneath on the bottom here, we actually have our drive air stems. Depending on the handpiece that you're using, we can adjust the drive air pressure that are recommended by the manufacturers. And so if it's W&H handpieces, we have specific drive air pressures that we recommend to keep the turbine lasting, as we have seen with lower or higher PSI for that drive air. So that is in line with the specific knobs for our water coolant. As we swing this delivery system back around and I pick up my tray, there's a couple of different positions that we can have the tray on the delivery system. So you'll notice that right here we have it mounted underneath, or we have it mounted coming off the side. There with our traditional delivery system, not our Continental, but with our traditional delivery system, we can mount this wherever we would like. The nice thing about having this underneath is that this rotates freely for wherever you want to place it. So now this tray, whenever we want to put this tray into the tray holder, we just basically slide that into place. The tray holder can slide back and forth, as well as we can turn this horizontally and place this right there as well. Same idea over here. We can place this way, slide it forward, slide it back, depending on however you want that tray to be placed onto the delivery system. So as we move into handpiece positions, the one thing that's important to know is that we have one additional handpiece position on this new delivery system. We have the ability to utilize the powered USB hub to utilize a camera if we would like, and then we have 4 wet block positions as well as our air-water syringe. These handpiece positions can be adjusted to where if you feel like you're pulling from this position more often, we could replumb this delivery system to have these handpiece positions wherever you would like. On the traditional delivery unit, when we have our handpieces, that they're going to be placed just like this, and we'll show you that. On the traditional delivery system, with your handpieces in place, you can adjust the way that those handpieces tilt in that delivery head. The tray holder we touched on. Getting into the touchpad itself, this is the new Deluxe Touchpad Plus. This is now a glass cover with a capacitive switch on it as well. As you'll see, the buttons look a little bit different than our existing touchpad. Starting on the upper left corner of the touch, we have one auxiliary button that if we wanted to tie in any type of low voltage auxiliary piece of equipment, whether it's a fan or a clock or some type of movie or TV or anything like that, we could turn that on and off with having that button right there. Right next to that button is a screen lock button. Holding that down will actually lock the screen for 15 seconds, and that will allow you to wipe the screen down without engaging any of the other buttons. So once that stops blinking, that will then allow me to get to my next button, which is my light button. In our previous in-services on the light, we showed you that you can manually turn your light on and off from the touchpad, and you can also cycle through all the settings or hold that button down to turn the light off. The button next to that is our A and B user button. Right now, as you see, we are in the A position for the settings on the touchpad. If I depress this button, now I'm in the B settings. This is nice for offices that have associates or multiple doctors that work a Monday, Wednesday, Friday, or then they switch to a Tuesday, Thursday, something like that. These can store specific settings for electrics, endo, scalar, anything like that, as well as stored positions of the chair. If one doctor is a little bit taller, they need the chair a little bit higher versus a doctor that's a little bit shorter, they might need the chair a little bit lower. Those settings can be stored specific to the A and the B user. So the button below that is our cuspidor bowl rinse button. That button right there, if you do have a cuspidor associated with the chair, you can utilize that button to clean your bowl rinse. The button right next to that is going to be your cup fill. Right next to that button is the water droplet. That gives you the ability when you pull your handpiece forward to turn your water on or off. You also have the ability through the 3-way switch on the foot control to turn that knob on and off as well. This air icon right here to the right of that also allows you to turn your air coolant on and off. So those buttons control your water and your air. Below that are your memory buttons. Memory 1, Memory 2, Memory 3, and Memory 4. These buttons allow you to change the power settings, the torque settings, any of those type of settings, whether it's your electrics or endo, we can adjust through that. So if we were using a slow speed, we can set it down to 20,000 RPM, or if we're using our high speed, we can set it at 40,000 RPM. As well as if we're in endo mode, we can adjust those specific settings as well, whether it's different files or different Newton centimeters that we need to adjust. As we move below that, those are our presets for our chair settings. We have our entry and exit mode. We have our treatment position or in supine. The last button over here on the right is our last stored position. That is in case the doctor has an emergency or a phone call, they need to go do a hygiene check. They can get the patient stored in the correct position for that specific treatment based on that patient size, and then they can hit that button. It will then bring the patient chair up and bring that patient into a more comfortable position. They can walk out of the room, go do what they need to do, come back, hit that button. It will then bring the patient back into that last stored position. Underneath those buttons is, this looks like 3 attachments on the touchscreen. This allows us to toggle between endo and electric mode with our electric motor. Next to that we have our gray manual buttons as far as the toggle between moving the chair base up and down or the backrest forward or back. Below that we have our plus minus button. That will allow us to increase or decrease the power of our electrics, of our scaler, of our the power to our advanced air mode. That will allow for those adjustments simply there. And then this last button on the far right, that allows us to turn the handpiece into reverse or go into forward depending on if we want to reverse that electric or anything like that. Same idea if we touch our into endo mode here. We can go into auto reverse mode if we would like by depressing that button as well. So as we move from the touchpad to the delivery system itself and being seated ergonomically with the delivery system, and this specifically the Continental delivery system, as I take a seat in my operator stool and I'm seated properly in the stool and I start to work towards being seated comfortably where the patient is then seated properly, the one thing that's really important to see is that with the capacitive switch and the positive positioning of the delivery unit, it's very easy to move this delivery unit or drive the delivery unit to where you place it to where you want it to be. With our older Continental style delivery head, you really had to position the head properly, sometimes even being transthorax over the patient, and the patient felt a little uncomfortable with the head being positioned right where it was. But with this new delivery system, if we kind of park this delivery system off to the right of the patient's right shoulder, it will allow us to be seated more at the 12 o'clock. It will give us better ability to cut down on our class 4 and 5 movements. We will now be able to do an open-handed class 3 movement, which will allow us to cut down on the amount of looking away from the oral cavity to grab hand pieces with the Continental delivery system. So if I bring the clinical light overhead and I position it in the proper position to where I'm going to use it about 10 degrees off of my field of view, I turn the light on. I can then position that light where I'd like, and I've got that and that 27-inch focal distance. So as I look in the oral cavity and as I reach over with that class 3 movement, open palm, utilizing that kind of perceptual blindness, if you will, I can pull the handpiece towards the oral cavity and I can place the handpiece in the mouth. And what you'll notice is that the whip kind of works with me, and I don't really have to have this positioned properly all the time. But what I would say is if we park this off the right hip and we have it in that position, it will allow us to very easily reach for a slow speed, a high speed, very easily while staying with our eyes in the oral cavity. This allows us to cut down on what's known as ocular accommodation. So every time you look in the oral cavity, bright light. Right now we're at 30,000 lux as far as light intensity, and then we look over towards our handpiece to grab it. Our pupils dilate and constrict based on that light balance, if you will. So with the Continental delivery system, if we get in the tendency to just open palm up, reach over, it makes it very easy for us to grab and utilize that perceptual blindness to grab whichever instrument or attachment we need to grab without having to fight the tubing. The other nice aspect of utilizing a continental delivery system is that on average the tubing has about 12 grams of tug when you're utilizing a traditional delivery system. So if I were to bring this down like you would typically have, you would have a little bit of tug that would be pulling on your hand. So that's going to help with the idea of not having that tug on the wrist as well when utilizing the continental delivery system. Overall, if we can get into the habit of knowing where the handpieces are, it should make it very easy for us to be able to park this delivery system where we would like and grab the handpiece that we would like with that open palm aspect and be able to put it into the hand, deliver it to the patient's mouth very quickly and easily. These are a few aspects that we can utilize with the continental delivery system. Obviously, if we go from continental delivery system to traditional delivery system, we might get pretty good at being able to pick up that handpiece where we would like, but it will be a little bit more difficult to then place that handpiece into the holder valve that it is associated with. So take into mind the correct seating posture, the patient's head being properly positioned with that forward head carry, that little bit of V, if you will, in the headrest, as well as the traditional or the continental delivery system being placed in the proper position.